Today we'll talk about, is diabetes a family disease? Diabetes is a complex set of disorders characterized by persistent hyperglycemia. The two most common forms of diabetes are type 1 and type 2. Both are caused by a combination of genetic and environmental risk factors. However, there are other rare forms of diabetes that are directly inherited. These include maturity onset diabetes of the young and diabetes due to mutation of the mitochondrial DNA. Genetic factors make some people more vulnerable to diabetes. But the genetic cause for diabetes is also affected by diet, lifestyle, and environment. You inherit a predisposition to the disease, and then something in the environment triggers it. Genes alone are not enough. One proof of this is identical twins. Identical twins have identical genes. Yet, if one twin has type 1 diabetes, the other gets the disease at most only half the time. When one twin has type 2 diabetes, the other risk is at most 3 in 4. Today we will talk about how to manage stress in diabetes, which is very important. Stress increases blood sugar levels. Anxiety also makes management of diabetes very difficult. In diabetes, stress can significantly affect the ability to control disease. If you are under stress, you may skip a meal or forget to take your medication, which will affect your blood sugar level. So find ways to relieve stress, maybe through deep breathing, yoga, relaxing hobbies, get plenty of sleep, and above all, stay positive. Diabetes care is within your control. If you are willing to take your part, diabetes won't stand in the way of active, healthy life. Today we will discuss the medical adherence challenges that patients face in managing diabetes. Only 31% of Indian patients with type 2 diabetes have good control of diabetes, defined as an HbA1c level less than 7%. Poor patient adherence to diabetic medications is a well-identified challenge in achieving glycemic control. Poor medication adherence in type 2 diabetes mellitus is very common and is associated with inadequate glycemic control, increased morbidity and mortality, and increased cost of outpatient care, hospitalization, emergency management and visits, and management of complications in the hospital. Today we'll talk about women and diabetes. After giving birth to a baby, blood glucose levels should be tested regularly. Medical follow-up for all women who have gestational diabetes mellitus is very important. In 2 to 3% of women, diabetes continues after delivery. Gestational diabetes mellitus is an early warning sign that you can use to your advantage. You now have the chance to make lifestyle changes to help reduce that risk for a longer term. Try to achieve and maintain a healthy weight, eat well, and exercise regularly. Today we will see if drinking water can lower your blood sugars. Drinking extra water will not dilute your sugar levels if you are already fully hydrated. However, being dehydrated can cause blood sugars to concentrate and subsequently rise. Drinking 8 glasses of water a day appears to bring down one's blood sugars by reducing insulin resistance due to proper hydration. So I suggest that you must seek medical advice and do regular checkups of your blood sugars